On Tuesday, legislatures debated the Transitional Healthcare Act, LB 1032. The bill is set to expand Medicaid funding and help uninsured Nebraskans. Nearly 70 Nebraskans gathered in the Capitol Rotunda to watch the debate. The gathering was led by members of Nebraska Appleseed, a nonprofit organization dedicated to civic justice.
My name is Molly McCleary. I am the staff attorney for the Healthcare Access Program here at Nebraska Appleseed. I've been here a little over 3 years. As healthcare attorney, my focus or my goal is to ensure that all Nebraskans have access to quality, affordable health coverage. And right now we have roughly 100,000 folks who don't have a pathway to coverage because they don't qualify for Medicaid as we currently implement the program, but also don't make enough money to buy insurance on the exchanges.
All of the people that Molly has talked to in this coverage gap are people who are working or wanting to work more. Some people have health issues that they cannot address because they do not have insurance.
I think the strategy at this point, or what is good for folks to remember, is that this is a 3-year plan. These kinds of plans get 3-year approval from the federal government, so that limiting the bill to 3 years aligns with the federal approval of this. It's fully paid for out of not general fund dollars or not through a tax increase or something like that, and then it's also gives time for us to prove that this will work and this will be an economic benefit.
97,000 Nebraskans are in the coverage gap, meaning they do not qualify for government funding. Kate Matson, field organizer of Appleseed, talks more about how people fall into the coverage gap.
I'm Kate Matson. I am a field organizer in the Healthcare Access and Economic Justice programs at Nebraska Appleseed.
In her position, Kate works with citizens that are hard workers, college educated, working 60+ hours a week, and they are still affected by the coverage gap.
Things like a sick family member or a job loss or an injury or disability have sort of put them in a situation where they are no longer able to access healthcare through an employer or to afford private insurance because their income isn't high enough to get those subsidies.
Although each person Kate works with has diverse experiences and situations, they all have common mindsets about the importance and need for health insurance.
They all have worked and see themselves as productive, contributing members of the community and know that being healthy is going to allow them to continue to be productive or more productive for people who are maybe sick right now and can't get healthcare access that they need.
Caitlin Lowy, a native of Lincoln, struggled with finding affordable health insurance in 2015 for herself and her husband.
At least half, if not more, of 2015, we could not afford health insurance through the marketplace or through our companies. Through the marketplace, we applied and we did not qualify for a tax subsidy of any kind based on the amount of money we made, and we could not afford to buy insurance.
This took a toll on Caitlin and her husband, James, both full-time students working and trying to keep up with bills. If something bad were to happen, they would not be covered.
We were uninsured for at least half the year, if not more, which meant if we got in a catastrophic car accident or had some sort of injury, we would have had to pay out of pocket for whatever expenses we incurred.
Caitlin and her husband found out that they were expecting their first baby in late August. They decided it was time to become insured.
So I researched the marketplace, Obamacare health insurance, my company's health insurance, and then the university's. And the university's policy was the best policy, although it is still really expensive for our budget.
Caitlin and James did apply for Nebraska Medicaid and were denied because they apparently made too much money to qualify. The Lowys have felt the burden of being in this Medicaid gap.
We definitely don't live lavishly. We are just making ends meet. All of our bills all of our money goes directly to our bills. We're able to maybe save away a couple $100 a month, if that, but we're definitely not living in any sort of condition of luxury, we make enough money to live, and that's about it right now. I think the biggest issue today for our tax bracket, I guess, or for young couples who are trying to start families and trying to work and keep the economy going, we are just being hit really hard with really high deductibles and really high premiums.
As of March 29, 2016, LB 1032 has been denied. Despite the blocking of this bill, supportive Nebraskans are still pushing to expand Medicaid. This is the Now Report. I'm Katrina Spurl.